Hello, everyone. Thank you for joining us today for the webinar entitled Educating Women About C-Sections, Preview of Final Campaign Materials. I'm Stephanie Teleke with the California Healthcare Foundation. I direct our maternity care portfolio, and I'm joined today by my colleagues and fellow webinar speakers, Eric Entebbe, Director of Communications at CHCF, Dr. Susan Perez, Health Services Researcher and member of the Consumer Reports team for this project, and Dr. Elliot Main, Medical Director of the California Maternal Quality Care Collaborative. I'm very pleased to share information with you today about this effort and show you the final products as we gear up for our formal public launch tomorrow. In terms of an agenda for this webinar, we plan to tell you a bit about the history of the project, the development research we conducted, our findings. We want to show you the products, and at the end, ask for your help in spreading the word. We have a lot of information to share with you in a very short amount of time, so we're going to move rather quickly, and we'll take questions at the end. Before we get started, just a little housekeeping. All lines will be muted throughout the webinar. Please plan to submit your questions online. You can do so at any time through the Q&A platform located at the bottom center of your screen. Please note this is not the chat function, it's the Q&A platform at the bottom of your screen. This session will be recorded, and the recording and the slides will be available on the CHCF website within 2 weeks of this webinar. And please also look for an email with additional information about how to engage in this campaign after the webinar. First off, I want to tell you a little bit about our development team. There were 3 key organizations involved in this work. My organization, the California Healthcare Foundation, the California Maternal Quality Care Collaborative, and Consumer Reports. Across these 3 organizations, we were a large interdisciplinary development team with deep expertise on many relevant fronts. This was truly a team effort over the course of more than a year, and our expertise includes clinical care, health services research, public health, psychology, consumer engagement, communications, social media, and video. You will hear a few voices on this webinar, but there were many, many other people involved in this work, which was truly a large collaborative undertaking. In terms of the project history and why we did this work, as many of you are aware, there is now in play a statewide effort to lower the rate of low-risk first birth C-sections to 23.9, which is the Healthy People 2020 goal. As many of you are also aware, there is wide variation currently at the hospital level in C-section rates, ranging from a low of 16% to up to 70%. This is a staggering discrepancy, which indicates that something is very off. An important part of this work has been the CMQCC toolkit and the collaborative to educate providers. This toolkit is free and publicly available, has been downloaded about 5,000 times, and has been used in quality improvement collaboratives with 100 hospitals in California, as well as hospitals in other states and even internationally. But we kept hearing repeatedly that there was no patient-facing materials that mapped to the CMQCC effort. In particular, Smart Care California wanted patient education materials to engage patients in the statewide effort. Smart Care California is a public-private partnership to promote safe, affordable care in California. It's led by the Department of Healthcare Services, Covered California, and CalPERS, which together purchase or manage care for 16 million Californians, or about 40% of the state. In addition to Smart Care, others also signaled a desire for patient education materials, so we were hearing a need for such materials from many parties. More specifically, Smart Care and other stakeholders requested that the educational materials meet several criteria: that they be simple and understandable to low literacy audiences, that they be suited for wide distribution, that they be consistent with CMQCC's provider toolkit, and that they be available in both video and print form for online and offline distribution. So we set as our starting goals to develop consumer education materials, again in both video and print, about C-sections for wide distribution that would do two key things. First, raise awareness about C-sections and the importance of avoiding one unless absolutely needed. And second, to encourage informed, shared decision-making between the woman, her doctor, and other members of her care team. A really important thing that we are not trying to do with this work is eliminate all C-sections. The goal is not a 0 C-section rate. C-sections are very important and they can be life-saving in certain circumstances. Rather, this project is really about educating women to appreciate key facts about C-sections, the overuse of them, which is real, and has an evidence base to support our concern. It's about helping women be part of the solution to using C-sections appropriately and encouraging more dialogue and shared decision-making between women and their care team on this topic. In terms of the intended audience, our primary audience is first-time, low-risk pregnant women in California. Importantly, we explicitly are not trying to engage women who know already that they want to have a C-section. This makes up approximately less than 5% of women who have C-sections, surveys show, but in any case, we are not trying to change those women with this educational effort. A very important secondary audience are providers who are key to making the consumer education work. So hospitals, physicians, labor and delivery nurses, midwives, doulas, and others. It was not enough for these materials to work for consumers. They also had to work for providers, since we are looking for a partnership here. This made development of messaging challenging, as we have had to walk some very fine tightropes to deliver materials that speak clearly and truthfully to consumers without also alienating providers. I want to turn things over now to Dr. Susan Perez of the Consumer Reports team, who led the research, to tell a little bit about the research and development of the educational materials. Susan?
Thank you. So while we very much kept providers in mind to keep with our shared decision-making goal, our focus was on women because this project focused on educating them in effective ways. Women and what we learned and heard from them were our primary guide in this project. The team identified 3 regions across California: Los Angeles, Fresno, and Oakland, to capture regional variations, including rural versus urban, variation in C-section rates, and density of hospitals. The team intentionally oversampled participants who identified as Hispanic or Black, those who were insured through Medi-Cal, and first-time mothers. We first began with a focus group of mothers who had had a C-section to learn more about the messages and information they wished they had known. Our second step was to understand the experiences and concerns and opinions for educating women about C-sections. So we conducted individual interviews with providers. We interviewed healthcare professionals from 3 different types of healthcare professions: OBGYNs, family practitioners, and midwives across the United States. Participants were chosen to represent a range in approaches to caring for expectant mothers, geographic regions, and clinical practices. Third, we conducted focus groups with first-time expectant mothers to understand their attitudes towards C-sections, their motivations, and ability to take specific actions. Next, we used our findings from the focus group to develop the first iteration of our materials and tested them in one-on-one, in-person interviews to test prototypes of educational materials with expectant mothers, using the most promising messages and messengers identified. Then, we tested the near final education materials to determine if they motivated women to initiate a conversation with their doctor and care team. We called this our secret shopper phase. We asked participants to view the videos before their next prenatal visit, and then we interviewed them about their conversation with their healthcare provider. Finally, we just completed user testing of the consumer-facing website. Draft materials were vetted with these key stakeholders at a few junctures during the project. This is by no means an exhaustive list. Stakeholder feedback resulted in adjustments to terminology and phrasing in the videos. The key takeaways from this study are: participants wished to make more time for self-care, but self-care while pregnant was often aspirational. Many participants expressed motivation to be healthy by eating right and exercising, but many found it difficult to initiate or sustain these self-care activities. Barriers to self-care were lack of time and concern that self-care appeared selfish. Many of the participants were family caregivers, if, for example, caring for their partner, parents, nieces, and nephews. And time taken for self-care meant taking time away from caring for family. When participants realized the link between self-care and caring for the baby, they recognized that birth-related care is a necessity, not a luxury. When it comes to fear of C-sections, we learned that participants already felt some level of fear towards C-sections. For this reason, we only need to share a couple of facts on risks, and we don't need to overemphasize or engage in fear-mongering. So for example, our top statement tested was, because a C-section is a major surgery, it takes longer to heal, and there's more possibility of more complications compared to a vaginal birth. The most common complications include infection, heavy blood loss, and a blood clot in the legs or lungs. Participants were drawn to statistics about hospital variation. Focus groups revealed that expectant mothers were not aware of the problem of variation in C-section rates. Sharing these facts is a motivator for action. After seeing 2 one-minute videos, participants wanted to know the reasons for the variation and rise in hospital C-section rates, and how to engage in a conversation with their healthcare provider about reducing the likelihood of an unnecessary C-section. Thank you. And based on the research, among the actions that could be taken in the messages, we landed on the following. So for the statement, "It's your birth, your voice matters," builds women's confidence to speak up and ask questions. We learned that participants are loyal to and trust their healthcare providers, even if they are not satisfied with their patient-provider relationship. A high level of loyalty and trust, along with a high paternalistic view of their doctor's role, results in unwillingness to question or challenge their healthcare provider. The statement, "Educate yourself," directs women to seek out resources about how to avoid a C-section unless absolutely needed. The statement, "I learned many things I could do to avoid having a C-section I didn't medically need," develops a mindset that it is best to avoid a C-section unless it is absolutely needed. And finally, the statement, "Talk to your doctor, nurse, and family members," encourages women to talk with their doctor and care team about their birth preferences. Now I'm going to turn it over to Eric to talk about the campaign.
Thank you, Susan. So now I'm going to go over some of the different educational materials that we've developed and some of the resources that we have for all of you to be able to participate in this campaign. So the first thing I want to do is just give a quick overview of all of the different resources. And so we have developed 4 videos, a website, which is kind of a resource specifically for consumers, and brochures and posters. And we focused on this particular kind of portfolio of materials with kind of 2 strategies in mind. One is that we wanted to be able to reach people online. We knew that that's how many people will be learning about this campaign and sharing information with people in their social network. And so we developed videos that could be distributed online, and then a website where we could direct people for more information. And then we also realized that many people will be educated in physical spaces. And so we thought that the videos could be shown in birth education classes, in waiting rooms, in doctor's offices, or in hospitals. We also developed these print materials, brochures, and posters similarly to be able to disseminate information in the physical spaces where we knew pregnant women would be. So when thinking about the campaign, we started with video, and the reason why we started with video was because we knew that that was going to be the highest bar that we would have to meet for any materials that we developed. And so with that in mind, we decided to use animation as the basic kind of sort of creative approach to use in the videos, and we did that for several different reasons. One is that we knew that there was a lot of information out there on pregnancy and birth and parenting even, and that there was a lot of different existing styles, and that the ecosystem in a sense was fairly kind of cluttered, and we didn't want to just add to that. We really wanted something that was fairly distinctive, so that if everybody was using this campaign, it would really kind of stand out and have kind of a brand of its own. So we wanted something with a distinctive and original look and feel. We wanted something that could communicate complex ideas in less time and in simple ways. We also knew that we were going to be trying to educate a very diverse audience, and we know that with animation, you can represent people in more ambiguous ways, and it actually helps audiences generalize. And if you were to use live video or real photographs of women, people are more likely to jump to conclusions and say, hey, that person is not like me. They're willing to sort of suspend belief a little bit when they're looking at something animated. We also knew that once we established a style and a look and feel for video, that from that we could use the same characters and visual elements in the print products, like the brochures and the videos. And then we also knew that, again, because that we were going to be doing, we were trying to communicate with diverse audiences, it was ultimately going to be more practical and cost effective to work with animation compared to live video. So you can easily, for example, have the same animation re-recorded with a Spanish speaking voice talent, and you would just have to layer that onto an existing video. So all of those, none of those reasons on their own was the sole reason, but it was really sort of the whole package. And then we also know when it comes to communications that the messenger is often as important as the message. And through our focus groups and testing, we paid very close attention to what we learned about women's preferences for getting information from different sources. And we landed on two in particular as our key messengers. One is the labor and delivery nurse, and the other is a new mom. And we picked both of those for different reasons. We knew that for many women, it was going to be helpful to get information from somebody who had additional education and additional expertise as a medical professional. And nurses certainly fit that bill. We found that doctors were a little bit more problematic, that there were several women in our focus groups who had more sort of complicated histories with doctors. They'd had some bad experiences, and that made it harder for them to just kind of generally trust them in all cases. And we didn't find that as a problem with nurses. The other reason why we chose to focus on nurses was because we actually thought there was an advantage to elevating labor and delivery nurses in the mindset of first-time pregnant women. They don't think about the role that a labor and delivery nurse can play while they're in the hospital in labor, but by elevating that character ahead of time, we were doing more to sort of prepare them for the opportunity to have an ally, or to make the best use of the ally who was going to be there in the hospital. And then the other messenger we focused on was a new mom, and that's because we found that women do seek out information and insights from other women who have gone through these experiences already. And so hearing from a new mom, someone who had just gone through labor and childbirth and kind of able to report back on what they learned, that was going to be a very relatable character for a lot of these women. And we found that in general, both of these characters work pretty well across the board, although some women really, they really wanted to hear from the expert, and other women really wanted to hear from someone they could relate to. And there was no way for us ahead of time ourselves to predict which women were going to respond better to which types of people. And so we thought it was helpful to have both. So now we're going to show the first two videos. These are each about a minute long. One is going to be from the labor and delivery nurse, and the other will be from a new mom. And these are both really our gateway videos. They're the ones that are intended to really get people interested and motivated to learn more, get them to go to our website for more information, and kind of get them down, just started on a path for using their voice and exerting their preferences.
Hi, I'm Lucy, and I'm a labor and delivery nurse, which means I help a lot of moms have their babies. Did you know that hospitals do a lot more C-sections now than ever before? In fact, your chances of having a C-section can be much higher at some hospitals than others. Let's say you have a normal, healthy pregnancy. At one hospital, your chances of having a C-section could be 2 in 10. At another, 3 in 10. And at another, it could be as high as 5 in 10. Why the difference? Some hospitals are quicker to perform a C-section than others, even when they could have been avoided. This matters because if a woman has a C-section, there are more chances for complications like infections and heavy blood loss. And it's a major surgery, so it takes longer for the mom to heal. Remember, it's your birth. By taking steps early, you can make a difference for you and your baby. Talk to your doctor, nurse, midwife, and family members. Let them know you only want a C-section if it's absolutely needed. Then ask how you can work together to reduce your chances. Your voice matters. Educate yourself and talk to your team today.
Hi, my name is Nicole, and I'm a new mom. When I was pregnant, I learned that more C-sections are being performed in hospitals than ever before, even if the mom and baby are healthy. This worried me, so I decided to educate myself. I learned many things I could do to avoid having a C-section I didn't medically need. I learned how to talk to my doctor about what I wanted for me and my baby, and I brought a friend to my doctor's appointment in case I was too nervous and needed support. I told my doctor I wanted to avoid a C-section unless it was absolutely necessary. When I got to the hospital, I told my nurse too, and she was really helpful during labor. I know there are many things in life I can't control, but I believe it's better to do what I can to make a difference, especially when it comes to my baby. Remember, your voice matters. Educate yourself and start talking to your team today. If I can do it, so can you.
So I should note that that all of the videos are available in captioned versions and without captions, so that for people who are hearing impaired, and also when they appear online, say on Facebook, you'll want to have a version with that can be read without sound. So now we're going to we have two other videos that we created. Those first two, again, as I said, were really the gateway videos just to get people interested. But once we've got them interested and motivated to learn more, we also wanted to be ready with a couple of videos that could help go a little bit deeper into a few key topics that we knew were going to be especially helpful for women. The first of those is a Q&A, kind of modeling a conversation between a pregnant woman and her doctor, and we focused on this one really for two reasons. One is if talking to your doctor or care provider is a high priority for this campaign, that's an action that we want women to take. We wanted to kind of demystify that and model that for them so it would be an easier conversation for them to have. There's also a side benefit in modeling that for doctors as well, so that it would become an easier conversation for them to have too. And then the other thing we learned throughout our testing was that when you just show the amount of information that you can include in a 60-second video, and in particular, you let women know that C-sections are more common now than ever before, or that there's variation among hospitals in terms of how, what their C-section rates are. The first question that women ask is why. They want to know why there are so many C-sections. And so we thought it would be very, very important to have a video at the ready to answer those questions. So we're going to show you that first video.
Well, Mary, everything is looking great today. You mentioned you have a few questions about C-sections?
I've been doing some research and I'm confused. Are some women getting C-sections they don't really need?
For some births, cesarean sections are really important. They can save lives or reduce the chance of complications for the baby and the mother. But it's also true that C-sections have become too common, and many could be avoided.
Oh, why's that?
Well, there are many reasons. Here are a few. One big reason is that sometimes doctors get conflicting information during labor. For example, electronic monitoring during labor produces a lot of information for doctors to worry about. Sometimes that information can be a false alarm, so doctors sometimes perform a C-section on more women than might really need one.
But I know lots of women who have had a C-section. Aren't they pretty common?
Well, that's another reason there are so many more C-sections today. They've become so common that many people now accept them as no big deal. But a C-section is still major surgery. Like any surgery, it should only be used if it's absolutely needed. Both doctors and moms tend to overlook how C-sections increase the chances of having major complications, like infections or heavy blood loss.
Oh, I didn't know that.
And a third big reason more C-sections are being done today is that doctors make decisions based on your current pregnancy, not future pregnancies. But a lot of women don't realize that once you have a C-section, you have a 90% chance of having another C-section when you have your next baby. And with each C-section, the risks of major complications go up.
What steps can I take to avoid a C-section I don't absolutely need?
Well, you can be careful about how much weight you gain and try to stay active while you're pregnant. It's also important to learn as much as you can about labor and birth. So take a birth class. You can find out the C-section rates of the hospitals and doctors you're considering. Also, have a skilled support person, such as an experienced friend or a doula, help you during labor. And of course, it all starts with the conversation we're having now. Your voice matters. Your doctor and your support team need to know what's important to you.
So I mentioned there was we wanted to have two videos at the ready once we've gotten the attention of women and they're motivated to learn more. This was the first one. And then we also created a video which is really about introducing women to the other members of their care team, their birth team, that they might not necessarily know about. I already mentioned the importance of the labor and delivery nurse. That is somebody that we find women don't fully appreciate just how important a labor and delivery nurse can be in their lives when they are in labor. But then in addition to that, we wanted to introduce them to a nurse midwife, a doula, and a childbirth educator. And so this video is really, gives the briefest of introductions, and it's really just to kind of orient women to the other possible allies and supporters that they might have in their lives when they're going through labor and childbirth. So let's show that video.
I'm Lucy, and I'm a labor and delivery nurse. If you want to have a healthy birth, it helps to have a strong birth team. That team includes your doctor and your family, of course. But there are 4 other people you should know about: the labor and delivery nurse, a nurse midwife, a doula, and a childbirth educator. It's not likely you would have all of these people helping you, but you should know who they are. I'm a labor and delivery nurse, a special kind of nurse who works with moms and doctors during childbirth. We're one of the first people you meet once you arrive at the hospital. Labor and delivery nurses monitor and support moms and babies during labor and give moms medicine if needed. After the baby is born, we help moms with breastfeeding and look out for complications. A nurse midwife is a nurse who has advanced training to care for moms during pregnancy, labor, and they can help you deliver your baby if it seems that labor and delivery will go smoothly. Nurse midwives are really good at helping moms avoid C-sections and other medical interventions unless they are absolutely needed. In the hospital, nurse midwives work as a team with doctors. They'll call the doctor if the birth becomes complicated. A doula is different from a doctor, nurse, or midwife. They're like having your own personal coach who stays with you all through your labor and birth. They provide emotional support and help with things like moving, breathing, and relaxing so your labor goes more smoothly. They'll show your partner how to support you in labor and can even help you at home after your baby is born with things like breastfeeding. Some hospitals give you the option of having a doula, but more often, you will have to hire a doula yourself if you want the extra support. Lastly, it's super important to be as prepared as possible for your birth. If you're expecting a baby, consider taking a childbirth education class. Childbirth educators empower expectant parents with knowledge and skills so they feel more confident about the process of having a baby. This is really important. Your birth matters, and your birth team matters. Start building your team today.
So we knew that it was important that we were going to, with each of these videos and with other things like our brochures and so forth, we were going to be able to direct women to take one particular action to get more information. We didn't want to just send them to Google and hope that they would find what they needed. We really wanted to make it as easy as possible. And so with that in mind, with the help of our friends at CMQCC who are hosting this site, we created a consumer-facing website called mybirthmatters.org, and this is really the home for information that is specifically for women who get sort of activated by this campaign. And again, when you get a chance to visit the site and look around, you'll see that it has the same look and feel. So there'll be continuity. Someone who watches the video or has a brochure and they go to this website, they'll know that they're part of the same world. And that was very important. This has lots of other resources in addition to each of these videos that we just shared. This has other information as well. And as I mentioned, that this is being hosted and managed by CMQCC. So it has alignment with what the information that they're providing to hospitals and providers. And then this website is also in English and in Spanish. And then in addition to that, I mentioned that we have brochures and posters. These brochures and posters really just reiterate the same messages as the videos. We don't really see them as a different wing of the campaign or trying to get different messages across. Really, we use the videos to figure out what messages work best, and then we present those messages in different media. The brochures were designed specifically to fit in the standard brochure racks that you find in doctors' offices and hospitals. It's just two sides of one kind of narrow sheet, but it's the same size as like a typical trifold brochure. And then the posters are 11 by 17. They're designed to be printed in 11 by 17 so that anyone could download them and then print them on a standard office copy machine. And these materials are also available in English and in Spanish. So I want to make just extra clear, make extra sure that everybody knows where to find what kind of information. So the campaign tools and materials for for all of you to use. If you want to participate in this campaign and help to educate women, we have a website, and it's actually being hosted. It's a page being hosted here at the California Healthcare Foundation on our website, and that's where you can get a communications toolkit that has sample messages that you can use and sample social media posts and more background about the campaign. But it also has the brochures and the posters for you to be able to download and print. And then where you send consumers to get information is the mybirthmatters.org, and that is being hosted by CMQCC. All of these materials are free. They are all available in English and in Spanish. As I mentioned already, all of the videos are available with and without captions. And that is true for the English and Spanish versions. And then all of these are going to be publicly released on Wednesday, June 20th, which is tomorrow. So, yeah. So there are three things that there are lots of different ways you can help with this campaign, but there are three specific things that I wanted to encourage everybody to try to do. The first is promote the videos on social media and in your newsletters. And as I mentioned, we have this communications toolkit on the CHCF page that I mentioned that gives you sample tweets or Facebook posts. And we'll have them in English and in Spanish. The second, embed the videos on your websites so that to the extent that you are already providing information to women, this is a, you could just sort of add this to your own suite of materials that you sort of regularly provide. And then the third is, put up posters in your sort of in your spaces and distribute the brochures where you have opportunities to do so. The one thing I would just say about all of these materials is that we are trying to keep everything consistent, and so the one thing that we ask is that you don't change them. That we've had all of these heavily vetted with a number of experts, and so we're asking that people not. I mean, you can use the messages that we provide, but we're asking that if you're using the brochures and you're using the posters, that you keep them the same. And for that reason, they are also branded with the three lead organizations that have partnered on this. In part because these are three organizations that are fairly neutral in the field, and we wanted to sort of maintain as much consistency as possible in the campaign. And the last thing I would just say is that for more information, you can direct your questions to info@mybirthmatters.org, and that email will be regularly monitored, and we'll try to get back to you as quickly as possible with whatever you need. I'm going to hand things back to Stephanie.
Thank you, everyone, for your interest and your time today. We welcome your partnership in sharing the educational materials broadly. Our hope really is that if you are pregnant in California, you kind of can't escape these materials. We hope that you will see them everywhere you go. They will be in your social media feeds. They will be in your doctor's office. And by doing that and having both providers and women see these materials, we hope that that will create an environment where these types of important conversations will be happening. As Eric mentioned, please get in touch with any questions. You have the email address there to send any questions that we weren't able to get to today or any others. And again, a plea to please let us know if you use these so that we can track uptake of them. A recording of this webinar will be available on the CHCF website in approximately 2 weeks. So spread that also to your friends if they were not able to attend today. Thank you again for your time, and this concludes the webinar.